As we grow older, our bodies change. We may notice aches, fatigue, or even changes to our skin. Most of the time, these changes are harmless, but sometimes they can be a warning sign of something more serious. One symptom that often gets ignored is a simple itchy spot on the skin. Many seniors think it is just dry skin or a minor irritation. However, in some cases, this could be a sign of skin cancer. Skin cancer is one of the most common types of cancer. The good news is that it can be treated if caught early. The bad news is that many people do not pay attention to the early signs. This is especially true for older adults. That is why it is so important to know what to look for. In this guide, we will explain why an itchy skin patch could be dangerous, what to look out for, and what steps you should take. Section 1. Understanding skin cancer. Skin cancer happens when skin cells grow out of control. There are different types of skin cancer. The three most common are basal cell carcinoma, squamous cell carcinoma, and melanoma. Each type starts in a different kind of skin cell. All of them can be serious, but melanoma is the most dangerous. Basal cell carcinoma usually appears as a small bump or patch. It may be shiny pink or red. Squamous cell carcinoma may look like a scaly or crusty area. Melanoma often looks like a mole that has changed in shape, color, or size. But these cancers can also itch. This is why a new itchy patch should not be ignored. Section 2. Why seniors are at higher risk. As we age, our skin becomes thinner and weaker. It is more likely to get damaged by the sun. Many seniors have spent years in the sun without using sunscreen. This damage builds up over time. The more sun exposure you have had, the greater your risk of skin cancer. In addition, the immune system gets weaker with age. This means it is harder for the body to fight off cancer. Seniors may also have other health problems that make cancer harder to spot or treat. That is why it is so important to check your skin regularly. Section 3. What an itchy skin patch could mean. Itching is a common symptom. It can be caused by dryness, allergies, or other skin conditions. But when an itchy spot does not go away, it can be a red flag. Skin cancers can itch because the growing tumor affects nerves and skin. The body may also try to fight the tumor, causing inflammation and itching. Some itchy patches might look like a rash. Others might be dry, scaly, or bleeding. The key thing to watch for is change. If a spot looks different than the rest of your skin or changes over time, you should get it checked. Section 4. Early warning signs to watch for. Here are some signs that a skin patch could be cancer. Itching that does not go away. A sore that does not heal. A mole that changes shape, size, or color. A new bump or lump. Redness or swelling around the spot. Crusting, bleeding, or oozing. Pain or tenderness in one area. If you notice any of these signs, talk to your doctor right away. The earlier cancer is found, the easier it is to treat. Section 5. How to check your skin. You can check your skin at home. Use a mirror or ask a loved one to help. Look at your entire body, including hard-to-see areas like your back or scalp. Use good lighting. Look for anything new or changing. Do a skin check once a month. Keep track of any spots and take pictures if needed. This will help you notice changes over time. If something looks different, don't wait. Make an appointment with your doctor or a dermatologist. Section 6. Want to see a doctor? If you find an itchy patch that lasts more than a few weeks, get it checked. If a spot is bleeding, crusting, or growing, that is also a sign to see a doctor. Even if you are not sure, it is better to be safe. A simple check could save your life. Your doctor may do a skin exam or take a small sample called a biopsy. This test will show if the spot is cancer. If it is, there are many treatment options. These may include surgery, freezing, radiation, or creams. Section 7. Preventing skin cancer. The best way to stay safe is to protect your skin. Here are some tips. Use sunscreen with SPF 30 or higher every day. Wear hats, sunglasses, and long sleeve when outside. Avoid the sun during peak hours, 10 a.m. to 4 p.m. Stay in the shade when possible. Do not use tanning beds. Keep your skin moisturized to prevent dryness and itching. These steps can help lower your risk. They can also keep your skin healthy as you age. Section 8. What if you already had skin cancer? If you have had skin cancer before, you are at higher risk of getting it again. That is why it is so important to have regular checkups. Follow your doctor's advice and continue to check your skin often. Stay alert for any changes. Tell your family and friends, too. Let them know what to look for and encourage them to get checked. Skin cancer can affect anyone, but early action makes a big difference. Section 9. Common myths about skin cancer. There are many myths about skin cancer. Here are a few. Myth: only fair-skinned people get skin cancer. Truth: anyone can get skin cancer. Myth: skin cancer is not serious. Truth: some types can spread quickly and be deadly. Myth: you don't need sunscreen on cloudy days. Truth: UV rays can pass through clouds. Myth: if it doesn't hurt, it's not cancer. Truth: many skin cancers do not hurt. Don't let these myths stop you from protecting yourself. Knowledge is power. Section 10. Final thoughts. A small itch might not seem like a big deal, but for older adults, it could be the first sign of something serious. The good news is that when skin cancer is caught early, it is highly treatable. That is why you should never ignore a spot that is itchy, new, or changing. Take care of your skin. Check it often. Talk to your doctor about anything unusual. And share this information with your loved ones. By staying alert, you can protect yourself and those you care about. Remember, your skin is your body's largest organ. It deserves attention and care. Don't ignore it. Stay safe, stay informed, and stay healthy. Section 11. How cancer affects everyday life. Living with cancer can impact daily life in many ways, especially for seniors. From emotional stress to physical symptoms, it's not always easy. If skin cancer becomes advanced, it may affect your ability to move comfortably, especially if lesions form on areas like the legs, arms, or back. Some people experience pain or bleeding, which can interfere with dressing, sleeping, and bathing. Mentally, cancer can cause anxiety and fear. You may worry about your health or your future. This is normal. Talking to a counselor, support group, or a trusted friend can help. Staying connected with others can reduce feelings of isolation. There may also be financial burdens. Some treatments or medications can be expensive. If you're on a fixed income, it's helpful to talk with your doctor or a patient advocate about affordable care or assistance programs. Section 12. Support systems for seniors with skin cancer. You don't have to face cancer alone. There are many support systems available for seniors. Family members, friends, and caregivers play a big role. They can help with doctor visits, emotional support, and daily tasks. There are also community programs, cancer centers, and senior organizations that offer help. You may be able to get free transportation to medical appointments or assistance with medications. Churches, libraries, and local senior centers often have helpful resources. Joining a support group can make a big difference. Talking with others who have experienced skin cancer can give you hope and valuable advice. These groups can be found in person or online. If you are a caregiver, remember to take care of yourself too. Supporting a loved one with cancer is a big responsibility, and you need rest and help as well. Section 13. Advances in skin cancer treatment. Medical research has come a long way. There are now more treatments than ever before. Some are very effective, even for older adults. Doctors can use surgery to remove cancer cells, often with very little scarring. If the cancer is deeper, they may use radiation or targeted drugs. Immunotherapy is a newer treatment. It helps the body's own immune system fight cancer. This can be helpful for certain types of skin cancer, especially melanoma. Another method is cryotherapy, which freezes cancer cells. Some creams can also treat early skin cancers. Your doctor will help you decide which treatment is best for you. They will consider your age, health, and the stage of the cancer. Ask questions and make sure you understand your options. Even after treatment, regular follow-up visits are important. These help catch any new cancer early. They also give you a chance to talk about any concerns. Section 14. Lifestyle changes after a diagnosis. Getting a cancer diagnosis may prompt you to rethink your habits. Some people make healthy changes after treatment. Eating well, getting enough sleep, and staying active are all important for recovery. Focus on a diet full of fruits, vegetables, and lean protein. Stay hydrated. Avoid smoking and limit alcohol. Gentle exercises like walking or stretching can improve your mood and help you feel stronger. Sun safety becomes more important than ever. Always wear sunscreen, even on cloudy days. Cover your skin and wear a wide-brimmed hat when outdoors. Try to stay out of direct sun during peak hours. Keeping a positive attitude and setting small, achievable goals can help you stay motivated. Recovery takes time, so be patient with yourself. Section 15. Encouraging others to be aware. If you've learned how serious an itchy skin patch can be, you can help others too. Talk to your family and friends. Encourage them to check their skin and see a doctor if anything looks odd. Share your story if you're comfortable. Real stories can inspire others to take their health seriously. You can also volunteer or support organizations that raise awareness about skin cancer. The more people know, the more lives can be saved. Remember, spreading awareness doesn't require big actions. Even small conversations can make a big difference. Everyone deserves to live a healthy life. By staying informed and alert, we can all play a part in preventing skin cancer. Section 16. Recognizing unusual skin sensations and changes. While itching is one of the most noticeable symptoms, there are other unusual sensations or changes that could also indicate skin cancer. These include tingling, numbness, or a burning feeling on the skin that seems to come and go. A change in the skin's texture, such as becoming thicker, bumpier, or developing a waxy appearance, should also not be ignored. Sometimes the area may feel tender to the touch, even if it looks normal. In other cases, you may find that the spot bleeds slightly or forms a small scab that heals and then reopens repeatedly. These signs are often dismissed as minor injuries or normal skin changes, but in older adults, they can signal something more serious. It's also important to note any discoloration of the skin, especially if it appears suddenly. A patch that turns dark brown, red, purple, or black might not be just a bruise or irritation. It could indicate abnormal growth beneath the skin. Section 17. The role of family in early detection. Family members can play a big role in identifying signs of skin cancer, especially in areas that are hard to see, like the back, scalp, or behind the ears. Seniors should feel comfortable asking their spouses, children, or caregivers to help with regular skin checks. Family members should also be educated on what to look for. If a loved one mentions an itch that won't go away or points out a strange new spot, take it seriously. Offer support by encouraging them to schedule a doctor's visit and even offer to go with them. Sometimes, older adults may downplay their symptoms out of fear or not wanting to worry others. Creating an open environment where health concerns can be discussed freely is one of the most effective ways to ensure early detection. Section 18. How emotions affect the healing process. Emotional well-being plays a key role in physical recovery. A positive mindset has been linked to better outcomes in many medical conditions, including cancer. However, receiving a diagnosis can bring on a flood of emotions: fear, anger, confusion, or sadness. It's important for seniors to acknowledge these feelings and seek support when needed. Talking with a therapist or counselor, engaging in meditation or mindfulness, or joining a spiritual or community group can help reduce stress. Even hobbies like gardening, painting, or reading can provide comfort and mental relief. For those with existing mental health conditions such as depression or anxiety, it's crucial to keep up with treatment plans and medication. Emotional support helps the body heal better and improves quality of life during and after treatment. Section 19. Staying informed about your condition. One of the most empowering things you can do after a skin cancer diagnosis is to stay informed. Learn about your specific type of cancer, ask your doctor questions, and understand your treatment options. Don't be afraid to seek a second opinion if you feel uncertain. There are many trusted sources of information online, but be cautious. Stick to websites that are run by hospitals, government health departments, or well-known medical organizations. Avoid self-diagnosing or relying on anecdotal advice from social media. Keeping a notebook of your symptoms, questions, and doctor's instructions can also be helpful. Bring it with you to appointments so you don't forget anything. The more involved you are in your care, the better decisions you can make. Section 20. Importance of long-term monitoring. Skin cancer can return even after successful treatment. That's why long-term monitoring is essential. This means continuing to check your skin at home, seeing your dermatologist for regular exams, and staying alert for any new or recurring symptoms. Most doctors recommend a full-body skin exam once or twice a year for those who have had skin cancer. If you notice anything unusual between visits, make an appointment right away. Over time, you may become more familiar with your skin and better able to spot changes early. This vigilance gives you a better chance at staying healthy in the long run. Section 21. Final words of encouragement. Facing a possible cancer diagnosis can be frightening, but remember, knowledge and action save lives. Many seniors who detect their skin cancer early go on to live long, fulfilling lives. Don't ignore the signs. Take time to care for your skin. Listen to your body. You deserve to live with confidence and peace of mind. Checking a patch of itchy skin might feel like a small thing, but it could be the decision that changes everything. Whether you're looking out for yourself or someone you love, staying alert and proactive makes all the difference.